There's some really solid, good recommendations. There's 8 of them that are intended to serve as guides for the future leaders in healthcare and today's leaders to say, am I preparing for the right things? Am I doing what I need to do to 2 or 3 years from now be able to care for the 33 million more uninsured that are going to come on the rolls? Or the retiring nurses as the economy hopefully picks up again. Who's going to take care of these patients, and how am I going to make sure I'm taking care of them to the best of our ability? So the studies what it's been has been the most successful from it is, like many IOM studies, it has been a catalyst for action. So almost every state in the United States, with 2 coming, so it'll be hopefully 100% soon, have created an action coalition that's been supported by the AARP and the Robert Wood Johnson Foundation. And these coalitions are intended to be the areas where local hospitals, health systems, integrated delivery systems can come together and understand what the report means, understand what the implications are in their state, and try to get active. There are a couple things that stand out that I would encourage hospital and health systems execs to look at today. And the first thing is, do you really understand the educational preparation of your nursing staff? How many of your staff are from an associate degree program or a baccalaureate program? How many of your staff are pursuing advanced degrees? The evidence is solid today that an advanced degree nurse makes a difference in clinical quality, in an ability to handle complexity, and an ability to deliver better care. 10 years ago, that wasn't so. So if you think you knew nursing 10 years ago, you don't really know it again today. And so asking those questions about what is your own BSN mix, what are your policies to promote that, is a critical step. The second thing I really would want hospital and health system execs to take a look at is, how are you onboarding nurses? What is your nurse turnover rate? Do you have a nurse residency program? Some of the evidence on nurse residency programs has shown turnover to drop by as much as 70%. It's a critical issue, as we know. Keeping nurses at the bedside is just a no-brainer. I mean, when you let them walk in and walk out the door in a short period of time, you're almost burning money, and there's no reason to do that anymore. There's always early adopters. So yes, there are early adopters. I mean, look at some of the national best recognized hospitals like Johns Hopkins. Johns Hopkins only hires BSNs. They have a 80% BSN mix, and they continue to support that. And when you look at many of the clinical outcomes across the United States, they're almost always at the top of that list. A lot of that, I think, is attributed to their nursing. Our own VA health system across the United States has taken very strong positions on it. And so there are organizations that have, but there's still 70% of us roughly that don't even offer a differential for BSNs. And there's even a smaller percentage of us that don't actually put a BSN in a preferred hiring status. Mm-hmm. So those are, again, simple steps and practices that execs could consider doing today to get us on the road. Absolutely, because you have to look at the cost of implementation against what your gains. You know, we all are facing the fact that we're going to look at getting value from healthcare. It's no longer per widget, it's no longer irrespective of the outcome matters. And so many of the things that are going to be reimbursed differently in the future are very nurse sensitive. It depends on a good nurse to prevent skin breakdown, to prevent falls, to actually assure that some of the other hospital-acquired infections don't happen. And so you have to look at, you know, the pay me now or pay me later scenario, as I call it. And so it's the upfront investment in your clinical staff that at the end of the day will actually probably save you money. And we all know, for example, an infection can cost 3 times more than just regular care. Many times we get short-sighted because on our P&Ls, there's not that line that says infection. It's embedded in drugs, in beds, in costs of organizations that don't jump out at you. I believe the enlightened CEOs, the enlightened leaders and executives for tomorrow recognize that even though that cost is buried, it's real money.